Good morning. Today we have invited Dr. Sujith Senaviratne, Associate Professor, Director, Cardiac CT Service, Interventional Cardiologist, Monash Heart and Monash University. Good morning and welcome to the studio, Doctor.
Good morning, Sally, and thank you very much for inviting me.
Doctor, we've got an in-depth explanation as to the diseases and how we treat them and how we get about it. Prevention, what is your advice about exercise and stuff? Let's talk about aspirin. What's your take on that one?
Yes, I think prevention is far more important than cure because it's much easier than cure, of course. And prevention, the first step in prevention is to address all your risk factors. As I mentioned, you can't address your genetic factors, but you certainly can address smoking. So if someone is smoking, it is absolute number one is to stop smoking. There's no doubt that smoking is one of the biggest contributors to heart disease. And then I would say the second most important contributor is diabetes. Once you got diabetes, as you know, it's very difficult to, you cannot really cure it as such, but very important that you have the best control possible. And then, of course, high blood pressure, very important to control high blood pressure. And of course comes cholesterol. Again, we discussed the dietary aspects of it. And then of course obesity, and when it comes to obesity, it's very important that you do regular exercise. So how much exercise is the question, and if you look at again what is the international guidelines say, we would say it is half an hour of exercise a day. You may not necessarily need to do all that half an hour in one go. You may split it in two, but generally we would recommend doing enough exercise to raise your heart rate. Just
to interrupt you there again, do you have to be overweight to exercise, or it can be normal and exercise to make sure that you prevent it?
Everyone should exercise, and it is very clear everyone should exercise. And if you got heart disease, it is an absolute must. And of course, even if you do not have heart disease, then one of the most important factors to prevent getting heart disease, of course, is exercise. So I can't emphasize enough how important exercise is. And when you look at weight, there are maybe three things that we need to discuss about weight. What can you do to reduce weight? It's a common question, and obesity, as you know, is a first world problem, more so than developing countries problem. One of the issues with the subcontinent is that we often have what you call central obesity, which is different to the standard obesity. So standard obesity is that you have fat deposition everywhere, whereas in typical Sri Lankan or Indian, you don't see much fat at all in your arms or legs, but the obesity is actually restricted to your tummy or to your abdomen. And that is what you call central obesity. So we could talk about a pot belly or something along that line. And in fact, that is a very important risk factor. We know that central obesity is a major risk factor for coronary artery disease and also for diabetes. What can you do about losing weight? And of course, all the common sense things apply. But specific things include carbohydrate. We know is a very important contributor to weight gain. So first step would be to try and cut your carbohydrates as much as possible. So what are the carbohydrates? So this is your rice, your pasta, your bread, your potatoes. So these are the high carbohydrate content. So try and minimize the carbohydrates to as little as possible. The second thing is to try and minimize your nighttime meal. So you can imagine if you have a big nighttime meal, you often go to bed straight away. There is not enough time for the food to be digested. Then you end up depositing them, and often as fat, and that leads to obesity. So cut the carbohydrates and then minimize your nighttime meal. You can have a big breakfast, reasonable lunch. That usually does not lead to much weight gain, but it is the nighttime meal which is the most important.
So totally cut out the nighttime meal or have an early nighttime meal where you have enough time to...
Yes, one option is to have an earlier nighttime meal and then to reduce the quantity of the nighttime meal. Of course, no one would say, well, that is my main meal. I'm feeling hungry if I don't have a big meal at night. I mean, you could still cut down your carbohydrate, but yet you can increase your protein content. That way you can fill yourself up, but not gain weight. Another theory being suggested perhaps is to try and do early morning exercise even before you have breakfast, and because at that stage or at that time of the day you haven't got any food in your system, and what you're burning straight away is fat, and you're not burning carbohydrates. So that's another theory that's been promoted. So having as little carbohydrate as possible, cutting down your nighttime meal, and perhaps trying to do early morning exercise before you eat are important factors for obesity.